Hello. Hi, Sandra.
Hi,
How's it going?
I'm okay. How are you?
I'm doing well. It's very nice to meet you. Thank you for coming into the office this morning. Let's see. Perfect. So you are right on time. Had you scheduled for a 9 o'clock, so thank you for coming in. I appreciate you. So it looks like you are here for a first-time derm visit, and you're wanting to just kind of go over your skin, have an assessment done, and then also have a look at your scalp?
Yes.
Okay. Is there any specific concerns that you wanted to go over today?
I have a lot of sun damage going on, so I don't know how to fix that.
Okay, sun damage. Are you outside quite a bit?
Actually, I just go from my house to my car
Okay.
and then the car into a building.
Got it. Okay, so just kind of in transit.
Yes.
All right. Okay, so I have that noted, and that's definitely something we will look at. Just gonna ask you a couple questions about your skincare routine, okay? So let's start in the morning. Do you typically wash your face in the morning?
Yes.
You do, okay. And then what does your typical skincare routine look like in the morning? Are you using like a serum, a moisturizer, eye cream?
Just basically moisturizer.
Moisturizer. Do you wear sunscreen?
No.
No, okay. So it's definitely something we need to discuss. So you don't wear sunscreen on a daily basis. Do you wear it when you're like, let's say you're going to the beach or going to the park?
Yes.
You do, okay. And do you know what SPF that is by chance?
It's usually about a 50.
50, okay. All right. And then, do you do any other skincare throughout the day before you go to sleep?
Just some nighttime moisturizer sometimes.
Nighttime, okay. Do you wash your face at night as well?
Yes.
Okay. And every time you wash your face, are you moisturizing afterwards?
Not necessarily.
No, okay. And how would you classify your skin type?
It's very oily.
Very oily, okay. Where would you say you produce the most oil?
It's usually in my nose and top of the forehead.
Okay, so T-zone area. It's pretty standard. All right. Any specialty skincare routines like face masks? Do you ever get facials, anything like that?
No.
No. Okay. Okay. Any issues with redness or abnormal skin texture?
I do have a lot of redness.
Redness. Any active breakouts?
I did recently,
Mm-hmm.
but that's where I also have a tend to pick at it.
Okay. So definitely want to avoid that. Okay, so I do have that notated. Do you ever notice any issues with swelling or like puffiness of the face, under your eyes, anything like that?
No.
No. Okay. That's very good. Do you by chance know any of the name brands of products that you use?
I don't remember.
So definitely always recommend going the fragrance-free route, especially when it comes to products applying to your face. Okay. Any special eye care cream or anything that you use around the eye area?
No.
No. Okay. Do you wear makeup on a daily basis?
No.
Do you wear makeup ever?
Yes.
Okay. To remove it, you wash your face?
Yes.
Okay, perfect. All right. So just moving on to a couple questions about your scalp. Okay, so any specific concerns about your scalp or your hair?
It just gets really itchy right at above the forehead.
Okay. So like about at the hairline?
Yes.
Any history of dandruff or scalp psoriasis?
No.
No. Okay. No active flaking or anything like that?
No.
No suspicion of any kind of infection like...
No.
Okay, perfect. And you recently come in contact with anyone who has lice by chance?
No.
No. Okay. All right. Any concerns about abnormal hair loss? Hair
I do
thinning?
have a lot of hair loss.
Do you? Okay.
It gets very thin.
Okay. So something we'll definitely look into. Is that a problem you've had persistently, or is that something that's fairly new?
It's about fairly new.
Fairly new. Any changes to your diet or nutritional intake?
No.
No. Okay. Any changes to your hair care routine?
No.
Okay. How frequently do you wash your hair on a weekly basis?
Every 2 days.
Every 2 days. Okay. And are you just using like a regular shampoo?
Yes.
Do you condition your hair?
Yes.
Lastly, as far as your skin health, any concerns about any abnormal moles or marks, anything like that?
No.
No. Okay. And do you have any questions for me before we get started with your examination?
No.
No. Okay, perfect. So we can go ahead and begin. I do apologize for the outside noise. Our office is being renovated and there's quite a bit of construction happening, so I hope it's not too disruptive. I'm just going to set this aside so we can get started. I'll be taking a couple of notes electronically as we go through just so I can document anything notable during your exam today, okay? All right, so I'm just going to begin by cleansing my hands. For the first portion of the examination, I will have my gloves off and then I'll put them on at one point once I really start getting more involved with your face. So I'm just going to start with a basic visual inspection. So essentially at this point, I'm just looking to see if there's anything notable just kind of right off the bat. So just looking to see if I notice anything with your skin texture, any abnormal coloring, also looking for facial symmetry and things like that. Okay? So just have you relax for me. I'm just going to bring your head midline here just a tad. Perfect. So just having a look at the overall skin health. I'll start on this side and then of course I'll move over to the other side. So starting up at the forehead, I do see some signs of sun damage there, so you do have quite a bit of freckling. I do see some redness around the ears. Skin texture and complexion is fairly even, so that's very good news. It does appear as if you have had your eyebrows microbladed.
Yes.
Okay. Any complications from that?
No.
Okay. So also just moving down, looking at the overall eye health. Eyelids appear very well moisturized. I will have a closer look at your eyebrows and eyelashes. So having a look at the nose, I do see just a little bit of congestion there. Lips appear very well moisturized. Notice just some slight reddening of the cheeks here as well as around the nostrils. Maybe one active blemish on the chin. So having a look around the hairline, very clear. Okay. I'm going to go ahead and turn on my pen light, and it is fairly bright, so you might want to keep your eyes closed for just a minute. So just going to shine my light. Looking for any signs of abnormality here that I might have missed with the naked eye. So just peeking over at the forehead. Again, seeing some signs of sun damage here. Just having a look over the eye area. Very good. Okay, so overall skin texture is fairly clear. Mild congestion of the pores along the nose. Do see one mole here on the side of your nose. We'll say that is right side. So I'm just going to take a quick measurement there so I can document that in your chart. So we are about circular mole, dark brown in color, about half an inch down, right nostril, quarter inch from the right eye. Okay, so just going to document any skin irregularities, that way we can have them in your chart, and should they change for future visits, we have everything notated accordingly. So moving down to the lower half of your face, having a look at the buccal area, looking at your cheek, as well as your cheekbones, down to the jawline. Do see a few, looks like healing blemishes that you might have been playing with down by your chin, so I will have a look at that. If and when you break out, is it typically on the lower portion of your face?
Yes.
Okay. Alright, I'm just going to have you turn your head towards me, having a look at the other side. See one small blemish here on the forehead. Left ear, a little bit of pinkening there at the top. So I see another mole here on the left cheek, so let me just measure that. Okay, so we are about an inch from the left nostril. And about an inch and a quarter down from the corner of that left eye. Alright, so again, small circular mole, approximately 1 inch from the left nostril, and about an inch and a quarter from that left eye. Alright, so moving down that left side, having a look at the cheek. Fairly clear there. Okay. Slightly pinkish color at the base of the chin there. A little bit of pinkening around the nostril as well. Okay, you can go ahead and relax your face for a minute. The next thing we're going to do is I'm going to have just a closer look at those moles before we get started with anything else. So I have a lighted tool here, and it is magnified. So this is just going to allow me to have a peek, look at the texture of those two moles a little bit closer. Make sure there's nothing concerning going on with the texture or the color or the symmetry, in which case we might look at having them removed just as a precautionary measure. Not super concerned about them just now, but I would like to make sure that there's nothing more concerning that could be going on. So I'm just going to have a bit of a closer look, okay? So again, this is fairly bright. I'll just have you close your eyes for me, and I'm going to be getting a little bit closer to your face this time. So just bear with me for a second. Alright, so just having a look here at this mole in particular. It's very circular in shape, not noting any particular signs of asymmetry there. Symmetric in shape and color, so I'm not concerned about that one. It does look okay. Alright, so I'm just going to turn your head slightly towards me, have a look at the smaller one here on that left cheek, and same thing, fairly symmetrical. This one is quite a bit less noticeable, not raised above the surface of the skin at all. Fairly circular, and color is even throughout. Good. So since I have this tool out, I'm just going to have a quick peek at that discoloration along the forehead. So just looking at this freckling, looking for anything particularly concerning here. Hmm. All right. Okay. Just going to update my notes quickly. So, upon further inspection, both moles appear to be quite healthy, not noticing any concerning, no cause for removal at this time. Now, should you come for a secondary visit or an annual follow-up, we will redo our measurements and have a look at them, of course, to make sure that nothing has changed. And obviously, throughout the course of the next year or so, if you notice any changes, specifically any changes in color or shape, be sure to let me know and we'll have you in and we can do a reassessment, okay? Start by measuring here at the forehead. We're about 5 inches across from the start of the hairline. Right over the eyelids, I apologize. About 10 inches there. And right over the mouth. 8 inches there. So 5, 10, 8. Right, so taking some vertical measurements here. Right side of the face. About 7 inches even. About 9 inches at the center and about 7 on the left. So fairly even there. So we got about 7, 9, 7. Vertical symmetry. Alright, so now I'm going to measure proportionally. So measuring the first third of your face, which is forehead to brow, about 3 inches there. Brow to nostrils, about 3 inches as well. And then lower nostril to chin. Okay, so your face is very symmetrical. It's about a 3-inch difference throughout, which is great. I'm going to switch tools here to a caliper, and this is going to allow me to measure bilateral symmetry. So I'm just going to use this tool to measure from side to side, so just relax with your eyes closed for me. Start here at the left brow. Very good. Fairly even there. Measuring left eye. And right eye, very good. And width of eye. And then width of eye versus width of nose. Okay, so I'm just going to measure. Even. Very good. Okay. use this tool to measure your bone structure here, so just keep your facial muscles relaxed for me. So just going to measure from the marker at the corner of the mouth. Very good proportional here. Same thing on the other side. Very good. Just measure from the pinna across the cheekbone down. Good. Slightly off-centered here at the bridge of the nose, but that's okay. Alright, so now just measuring from brow, base to the arch. Slightly longer there on the left side. And lastly, symmetry of the chin. It's very good, even with the chest wall. Okay. All right. All right, so just gonna update my notes on your measurements here now. The good news is your face is fairly symmetrical. Didn't notice any signs of abnormal asymmetry from one side to the other. I would say everything is pretty even. One sign of asymmetry I did notice is at the bridge of your nose, but that is totally normal. Just notating here, that left side was slightly higher. I did also notice that your brow arch is slightly higher on the left side as well. Now, just want to note that no one's face is perfectly symmetrical, so absolutely nothing to concern yourself over. Okay, so I have all of that documented accordingly. Okay, do you have any questions for me so far?
No.
Okay. All right, so we can go ahead and move on. And let's see. So before I start manipulating your face, I'm going to go ahead and take some temperature checks here. So just testing for temperature variation. I'm going to check different portions of your face and make sure that there are no areas that are possibly edematous or what we would consider hot spots or just warmer than normal. Okay? So just going to point this at your face. Just relax for me. Right at the hairline here. Starting on the right side. Definitely a little bit warmer by the neck. Slightly elevated by the chin. I am getting a little bit of abnormal warmth here, so we'll have a look at that. Again, slightly abnormal warmth by the lower half. And right side. Still slightly elevated, but definitely not as much as on the right side. So your left side is slightly cooler. Highest temperature here is about 100.8. So just going to measure the hairline and then just at the ears. Okay. All right. So temperature average is about 97.8, which is lovely. highest recorded temperature was 100.8. Lower right quadrant. Slightly elevated on the left, but not quite as high, so we were about 99.7 there. Okay, all right. All right, Sandra, let's go ahead and move on. So I think at this point I do want to go ahead and place gloves on. So I'm going to start with a little bit more of a hands-on inspection at this time, okay? So give me just a second. Okay, all right. I am going to be touching your face pretty in-depthly at this time. Is that okay with you?
Yes.
Okay, so if at any point it becomes uncomfortable or painful, please let me know. Okay?
Okay.
So starting off with some regular manipulation here, I'm just going to be palpating around, starting at the forehead. So just using my fingers to feel for any signs of abnormality. Not so much assessing skin texture at this time, more so looking for anything underlying. So anything below the surface of the skin. So you're just going to feel me moving my hands around gently here with the pads of my fingers. Okay, so all of that feels okay. Alright, so just to assess for skin texture further, I'm going to be using a different tool. Now, this is just kind of a flat plastic. It shouldn't cause you any discomfort. I'm just going to smooth this kind of over your face linearly, just like this. Down the side. So cheeks are very clear. This is definitely not a trouble area for you, aside from some light pinkening that I see under the eye. I am feeling some abnormality in texture here at the lower chin, so that's about slightly off-centered from center lip, the right side. Gently manipulating the hair, looking for any signs of flaking or excess dryness. Also looking for any redness, signs of erythema, and of course always ruling out infestation or any signs of lice. Okay, so I'm just going to use my comb to gently manipulate the hair here. Now you said the itchiness you were experiencing was around the hairline area?
Yes.
Yeah, okay. Is that a constant itching or more so just after or just before you wash your hair? Do you notice a pattern with that?
It's a constant.
Constant, okay. Can I have you lift your head for me for just a second? I'm just gonna loosen your hair here. Perfect, okay. All right. Now you said you also noticed some issues with hair thinning or hair loss.
Yes.
And that's new for you as well. Just gonna have a look. Combing through. Your hair is very fine in texture. It's very soft. It does appear well maintained. Very well hydrated. Definitely keep up with your hygiene. It's very clean. I'm not noticing any signs of foul odor. No signs of abnormal skin texture of the scalp. No obvious signs of infestation, so that's good news. Okay. Just having a closer look here, right at that hairline. Do you see just a little bit of dryness of the skin? So kind of where your forehead meets your scalp, there is just a little bit of dryness, which is likely why you're experiencing the itching. Now, you said your overall skin type is fairly oily. How would you classify your scalp? Is it oily, or do you feel like it's dry? Does your hair get greasy?
It gets very greasy.
It gets very greasy, okay. So that's likely why you're washing it every 2 days, I'm guessing?
Yes.
Okay. Now, as far as the hair loss, without further testing such as blood work, it's kind of hard for me to tell what could be causing it. Externally, your hair does appear very healthy. While it is fine in texture, it is very soft. It does appear as if you just have a softer, more baby hair-like texture. So if you're open to it, I would like to refer you to an endocrinologist, someone who can look into some hormone testing. They'll do some extensive lab work. We can see if there's anything going on with your thyroid. Those are often causes of abnormal hair loss in women. Also suggesting that because I do see some signs of hormonal acne around your chin. So because you're tending to break out on the lower half of your face, that leads me to believe that there could be some hormonal imbalances going on. So an endocrinologist can also test for something like that. Is that okay?
Okay.
All right, so I will get you referred out to our specialist, and they should be able to get you in fairly quickly. But aside from that, your scalp does look okay. So I'm just going to feel around for a second with my hands and see if there's anything notable of the scalp that I'm not catching. So just let me know if any of this is painful or tender. Any areas of particular discomfort of the scalp at this time?
No.
Looking for any signs of obvious weakening of the follicle. So as I apply this gentle pressure, I'm just notating any abnormal signs of loss of strength here, but that appears to be okay. So just going to test this front portion. Just not noting any gumminess. There doesn't appear to be a lack of protein of the hair. I do see a few split ends, but that's completely normal. How often do you have your hair cut or trimmed?
I've been going about every 6 months.
Okay. It's not too bad. I do recommend that you get it done about every 3 to 4 months, but if you're not styling your hair very frequently with hot tools, then 6 months or twice a year should be about fine, so that's perfectly okay. Now, while I'm at this angle, I am just going to palpate down your jawline, okay? So just once again, feeling for your lymph nodes, looking for any signs of inflammation or any other information that I can refer to the hormone specialist. If I notice any signs of abnormal swelling here, then that could be an indication of an underlying hormonal diagnosis, in which case that could explain some of the symptoms you're having. Even the slight reddening of your face, that could also be due to hormonal changes. So just feeling around the lower chin here. Any discomfort here at the jawline?
No.
No. Okay. Very good. So I'm not noting any swelling, not feeling anything palpable. There are no nodules that I can feel at this time. So that's good news. I'm going to use this tool here. Now this is just a spring-loaded metal. It's going to allow me to apply some pressure, and just going to push down on the forehead. And I'm just noting the return here. As I push down, it creates a small indentation, and just noting the time it takes the skin to return to normal texture. I do see a very slightly delayed response here, which indicates some signs of dehydration. So how much water would you say you're drinking throughout the day?
I don't remember.
No, okay. So I would say that you might be slightly dehydrated. If possible, I would try to increase your water intake. Also, make sure you're moisturizing adequately. So, in the morning, obviously, you don't want to use something that would make your skin look greasy, but you definitely do want to be moisturizing and then waiting about 5 minutes and applying an adequate amount of sunscreen, which is about a palm-sized amount to your face, and that's every single day, okay? And then, of course, remembering your reapplication, which is very important, especially with prolonged sun exposure. All right. So the very last thing I'm going to do is just perform some very mild percussion. Once again, just percussing over that drier area where you have some of that sun damage, and this just allows me to test again for loss of elasticity, checking your collagen levels, feeling for any abnormality here. So overall, I would say that it does appear that your skin is overly dry. Now, I know that might seem conflicting given that you appear to have oily skin. No, obviously you know your skin better than anyone else, but just my professional recommendation would be to adjust your moisture levels, increase your fluid intake, specifically water, eat foods that are high in collagen, and of course sunscreen is going to be your number one friend. So just make sure you're wearing your sunscreen. You could also look into a retinol. So it's just a cream that you would apply once a day, and that can help even out some of that discoloration. And then as far as the breakout you have here on your chin, it is very mild, but once again, the endocrinologist can have a better look at that when it comes to your blood work. Okay?
Okay.
All right. Okay, so just to follow up on my notes here. So again, it does appear as if you have some mild rosacea, specific pinkness around the nose and upper cheeks. So just summarizing my findings for you, Sandra. I'm going to go ahead and refer you to see our endo. I will put that information in your patient portal, but you can also see Rachel up at the front desk and she can give you a list of referrals. We do have an endocrinologist that works with the office, so you are welcome to see him if you're comfortable. If you have your own, though, that's totally fine. I can send you that referral electronically. And then as far as product recommendation, I do have a specific moisturizer I like to recommend to my patients. It's by the company La Roche-Posay. You can buy it at the drugstore. You can buy it at Target, Walmart, Walgreens, Amazon. It comes in a white bottle. It is a Lipicar AP moisturizer, so it's fairly thick in texture, but it does seep into the skin fairly well and penetrate that lipid layer, which is why it's preferred by dermatologists. So what I would recommend when using that product is to apply it within 5 minutes of washing your face, because that's when your skin is the most plump, specifically after you get out of the shower where you've retained a lot of that moisture. And then I like to just very gently mist my face before applying the moisturizer, and that kind of locks in that extra moisture. Okay? Just make sure you're getting adequate hydration, and of course, aiming for about 60 ounces of water a day. Just drink as much as you can. Okay? Did you have any questions for me?
No, I think that's good.
Okay, all right, Sandra. Well, thank you so much for coming in. I am going to go ahead and get that referral sent over for you. Again, if you'd like to make that appointment before you leave, you can do so up at the front desk.
Thank you.
Okay, all right. Thank you very much. Go ahead and take your time getting up. I don't have another patient coming in for the next hour, so you're okay to relax for a few if you'd like.